Hi everyone, I'm Divya, and this is Uplift, a show where we meet everyday women being everyday phenomenal. Holidays are upon us, so I wanted to do something relevant and special for us. Let's talk about mental health and some information that we all can use this holiday season or otherwise. We're meeting with Robin Brickell, who is a licensed marriage and family therapist with 25 plus years of experience providing psychotherapy, as well as the founder and clinical director of a private practice, Brickell and Associates LLC, in Old Town Alexandria, Virginia. Hi, Robin.
Hi, Divya. Nice to be here.
I'm really excited to have you, and I know you have a 6 o'clock appointment, so we're going to make this very quick.
Thank you.
Thank you. So, could you tell us a little bit about your practice?
Sure. So, as you said, I'm a licensed marriage and family therapist. I run a private practice in Old Town Alexandria. We see individuals, later adolescents, adults, and couples and families from a trauma informed lens, which really means that we're looking holistically at the client and really understanding what their coping skills are, what their trauma is, whatever that looks like, and how to be able to approach that from a non pathologizing, strengths based place, which allows people to show up in a judgment free space.
That's very, very interesting and beautiful what you're doing. I know everyone needs that in some form or the other. So we really appreciate you and the work that you're doing. So your entire practice is based around the trauma part of it, or there's like other therapists within your practice that help with other issues as well.
So, all of the therapists are employees of the practice, and we all work from this trauma informed lens. We see clients who present with different issues, whether it's depression, anxiety, food issues, substance abuse. We treat maternal mental health. We approach it from a trauma informed lens. So, really understanding, similarly to kind of the more famous book title these days by Oprah and Dr. Bruce Perry, to be able to say, right, like what's happened to you. So when we look at what's going on for people, we look at what's happened to them, what makes them choose or do whatever survival skill they're doing to be able to deal with life. We're not looking at what's wrong with people. We're looking at sort of what's happened to them and how have they survived.
So, what is your approach when clients come to you?
It's mostly different with different clients. The goal of good therapy for me is to really be present with my client and pay attention to what's important to them and who they are and what they want to share. For a lot of people, coming to therapy is scary or anxiety producing in and of itself. So the beginning stages are really just helping them feel safe in that moment. And then the beginning of trauma therapy is actually all about safety and stabilization. So, in a larger global picture, helping them figure out how to not be walking around in what we call hyper arousal or fear, really hyper vigilance of paying attention, especially for trauma survivors. They tend to be hyper vigilant about lots of things because that's how they stayed safe in their life over the years, by trying to stay one step ahead of whatever was going on.
It is extremely hard to find a therapist, I feel, over the last few years,
Yeah.
and the right therapist. And you know what you said earlier about initially when you are just meeting with a therapist for the first time or the second time, it just takes a lot longer because you really have to be feel comfortable to be able to open up about your history and all the things revolving, around your life, basically. It is so exhausting. I'm sure it's exhausting for you, but I think on the other side, it's really, really exhausting for patients, right, and
Mhm.
clients. What advice do you want to give to people? Because I think maybe that is also one of the reasons where it discourages people, right? Because if you put in that much effort and it's, let's say, they're not the right therapist for
Mhm.
you,
Mhm.
then doing that all over again, it is so incredibly hard. So what would you tell them?
So I would say start off by, um, well, let me even back up. You are right.
Yeah.
Right now, it is super hard to find therapists with space in their calendars and availability. What One of the benefits of COVID has been the reduction of the stigma of mental health, and people are actually getting help and asking for it, which is amazing and wonderful. The downside is that there may not be enough available clinical care in their
Right.
area to be able to provide the services in a timely fashion. So it is difficult. I always recommend sort of starting with asking physicians, asking friends, talking about this with people you respect and know. Start there to see if anyone knows a therapist. You can get a referral, etc. Those are better ways to start. In the fact that there's at least some connection.
Mm.
If you don't have those options or you can't find something there, you can go online and start reading people's bios and reading their websites, looking for, do they have, right? I write a blog. We keep social media pages, so you can know our approach and our belief over many years to see that consistency and does it fit with what feels like is right for you. um, you can research, you can ask to have sort of an introductory call with a therapist, to kind of go from there. Once you show up, if it's not a good fit, talk to the therapist. We're used to, at times it's not a good fit, and the therapist might be able to help you find a good fit for what you're
Yeah.
looking for. Right, good therapists are not offended by someone saying it's not a good fit. We want you to find good clinical care. And so I would never be offended if someone said that and said, could you help me find another therapist? That would be fabulous. I would want them to find the care that they need. um,
Yeah.
it isn't easy, and right now, it is harder than it's probably ever been.
Yeah.
I actually, one of the articles that I wrote not so long ago, a couple of months ago, was actually about what if you find yourself on a wait list or can't find the therapy that you need,
Mhm.
and how to be able to find support and things to do in the interim to hold you, until you can get in for the care that you deserve.
Yeah, I will definitely link that link to the blog in the description. Finding therapists is hard, but then when they start looking, maybe they don't have easy access in their community or neighborhood. So, what advice would you give to women, especially because this is a women-centric show, but it's applicable to everybody, right?
Right.
On women who don't have easy access to healthcare.
So I think there's a couple of options. Clearly I'm going to know the resources local to us versus everywhere, but
Of course, yeah,
um, there are support groups that exist that are free, whether they're 12-step programs if you need them for dealing with addiction or eating disorders, etc. There's also a lot of support groups that exist in communities. Community service boards we have here have a fair amount of resources that exist for people who don't have health insurance or who can't afford it. Right, your local religious affiliation, if you've got one, usually has some kind of women's group, men's group, etc., to be able to pull from. Um, there are a fair amount of organizations online that have 24-hour support groups. There's many for assault, for sexual abuse. There are some for maternal mental health. Postpartum Support International has a 24-hour hotline
mm,
all over the world, for women who are going through either pregnant or postpartum and need help as well. So there's a lot of organizations that have 24-hour hotlines local to us. Again, I keep referencing this, but on our website, we have a list of resources, both local to us and some that are national and a couple that are international, so that people can find them, right? If you or someone you love is suicidal, right, to be able to call. There are crisis text lines now, so people can text even if they can't talk. They can email. Technology sometimes makes things easier,
Yeah.
sometimes harder, but sometimes easier. So there are a
Okay.
lot of
You're
resources.
seeing, is it because of the like effect of COVID that more people are asking for help? Do you think the type of help that people are asking has changed, or what has made people ask? Which is great, right? Because people need to do that. We need to get over that stigma. But what is? I'm just curious to understand the reason behind it.
So, right, it's just my theory. I don't exactly know for sure. I think COVID isolated a lot of people.
Yeah,
Right, there's people who are not even getting the support of going to work every day. They're not seeing people's faces. They're not even getting to connect at all. And as human beings, we're wired for connection. And so, if we're not getting that, I think that that's so detrimental. I think that, right, that is probably part of what's gone on. Also, COVID, from my perspective,
yeah,
is a global trauma, right? The definition of trauma is perceived sense of lack of safety or threatened
mm,
harm, right? Well, I think most of us at some point during COVID have felt unsafe, right? We felt unstable. Like, what are things going to be like, right? And so that can be traumatizing. And so that raises the nervous system for a lot of people into hypervigilance or hypo, right? So they're either really anxious about most things or they're just checked out. I
yeah,
think a lot of people have coped with isolation and depression and anxiety during COVID. Also, right, not having to get up and out of bed and shower to go to work if they're virtual and working from home. People are using more alcohol, more substances, more
yeah.
food. And I think that that just continues to push forward this need for mental health care, which has always been there. It just is a wonderful outcome of COVID that the stigma has decreased. But I do think the need is there, and I'm not even sure we've seen all the need yet.
It's a holiday season, and already, like, winter setting in, and it's getting dark, earlier.
Hmm.
A lot of people are not going to be able to go see family. Like for Thanksgiving next week, I can't go see my family. I have to be in town for whatever reason that is, right? Whether it's COVID related or otherwise. What is your advice to people to just kind of get out of their funk a little bit? Anything that you would do personally or professionally to be able to just kind of feel a little bit better in spirit.
So I will share with you that I absolutely hate winter. I hate the darkness. I am a warm weather person. Anyone who knows me knows that. The idea that I'm getting to work and leaving work every day in the dark is
Yeah.
the worst time of year for me. So I absolutely hate it and can very much empathize all the time about that. I think, right, finding something that brings you joy. It can be, right, I like to come home from work at night and, right, immediately sort of take off my heels and put on my slippers. And I love like my fuzzy slippers and like
Yeah.
cozy clothes. I think finding some things that bring you joy, whether it's going for a walk if it's not frigid or you like the cold, that works. Finding even your favorite movie on TV,
Yeah.
connecting. One of the things that COVID has brought us also is the awareness that we have this ability to connect virtually, although I'm, right, in person is clearly better, in my opinion. But we have this ability now, so we can connect with more people more regularly. Right, laugh, have joy, right? Make your favorite foods, journal, try something new. I
Yeah.
think there are so many ways to enjoy the time. I am super grateful to not be traveling. For me, that is, it will be a little bit of downtime. I haven't had a lot with the last almost 2 years of uptick with work.
Yeah.
And so I'm super interested in putting on my fuzzy slippers and relaxing a little bit, maybe reading a book for fluff, and
Yeah.
just kind of going slow. So I think there are ways to sort of practice gratitude for what we can have, even while we're also holding what we miss, right? Like,
Yeah.
it's so hard for people who aren't able to go home, who aren't able to do what they want to do, right? So, how to be able to hold both, I think, is so huge.
Yeah. Wonderful. That is like, I'm going to follow at least some of it next week. I'm definitely going to cook a lot and
Good
probably
for
going
you.
to watch some movies. I'm going to have to pick some. But thank you so much for your time today. Um,
Thank you. Thank you for having me. Thank you for highlighting mental health. I love that.
Thanks everyone for watching and listening. I hope you find this episode extremely insightful. Please read through the blogs and the URLs that I'm going to be posting in the description. And I'll see you all next time. Happy holidays.
Happy holidays.
Bye, everyone.